The structure of the course at the moment is that you complete teaching block 1 in October, and those are the dates that are planned for this coming intake. So you're with us for a week in October. That's that full timetable that I just showed you there, subject to change. And then we have from October through to April, you take turns going on a clinical placement. Our clinical placements are facilitated by a really wonderful practice, a group of practices really, called Sterling Dental Centre in Southgate. They are an impressively sized dental centre with a number of practices within them. They do a lot of work with facilitating education for dentists who have trained overseas and who are looking to work within the UK. So they're very educationally aware. They're very very involved, very on board with kind of contemporary educational bits and techniques. So they're really great, and they're just really nice and supportive. I have to say that the feedback from students this year who've attended all their placements there has been just overwhelmingly positive and better than I could have hoped for. So that's been a really positive sign. There is an implication, of course, with coronavirus and COVID. I'm going to put all the virus at the end, but we'll talk about that. And then we have teaching block 2. Teaching block 2 is in April. And that's when you just come back. We do a few lectures just to cover some topics that maybe could have come up, or could cover some topics that maybe came up during your time on placement or on preparation or during your own quality improvement project. And then in the second week, in that teaching block 2, we do, you cover your exams, we do a simulation day, and we do advanced sedation club. Simulation day is a full day at the UCLH Learning Hospital. So it's a kind of fake hospital. You may have seen it. It was on some documentary with Robert Winston walking through it, him and all these robots. The robots weren't there when I go there. You get a kind of high fidelity mannequin with one eye open. And but it is actually a very good opportunity to train through some of the scenarios that can come up during delivery of conscious sedation, and kind of just discuss through some of the human factors. Human factors. I'm sure you've all heard, Elaine, about the sad case of Elaine Bromley. If you hadn't, write it down. There's something for you to Google after the session, little takeaway. But there's human factors around anaesthesia, sedation, and airway management. Just really important. So you come back, you do that, you do all your exams, and you go away again, and then to write up your report from your QI project. That's kind of how the year looks. And if you put all that together, combined with all the time you're supposed to spend reading the reading list and doing all the bits and bobs and doing your project, it's supposed to work out at 22.5 hours a week. And officially, that is probably what it works out as. Depending on your own learning pattern and your own level of experience with various elements of the program, you may find it takes, you might find it takes more. We'll just have to see. Going back then, just to cover, so you have your unseen written examination for clinical practice, and then you have the logbook. Within the logbook, you just have to get a certain number of cases signed, 20 intravenous, 10 inhalational, plus you have to do 2 direct observational procedural skills for your cannulas, and write a reflection. Then you'll see the quality improvement project report is there, and again, a reflection. That's the current assessment structure. It works out as 6 assessments. That's it, quite stripped back, I have to say, and we have done quite a lot of pruning on that, and we've gotten it back to the bare kind of essentials of what needs to be assessed.